Yeah, this is what you're feeling right in here. When you bring your shoulder back, all this tissue is compressing. Nice, there we go. All right. It's probably a little less intense. I think that the gua sha can be, more sore as you're.
It just feels tight.
Tight, yeah.
Yeah, like the skin's tight. Yeah, it doesn't hurt.
Oh, it feels so much better.
Cool.
Yeah. So I've been doing the dinner roll stretching. That's been going good. Been getting some progress on that, and kind of dropping down from the a 5 inches to 4, and then 3, and now into 2. So
Excellent.
That's been doing good. The target is really different to see it just focus up and land on certain spots. So when I can, I try and do more areas over longer and do 25, 30 minutes when when there's time and stuff. Yeah, so it's been.
You're getting there, yeah.
Yeah, it's been. I can really start to feel a pull, down in here, and really start to feel a pull back.
So the deep tissue work needs to be done to do 2 things. One, to get the joints to like each other. If the joints are so swollen, they won't overlap properly, and so we can't actually get a deep enough stretch to actually get to that ligament. And then if there's bruising alongside the spine, then the muscles, if they're all tight, they'll bind up and they won't let your body actually sink in, and then nobody wants to stretch when their back is killing them.
Right.
The mobility of your spine is what keeps the tissue clean. This left hip's a little high.
Yeah, I've felt a little bit of
My left hip?
Yeah, a little pain there.
Okay. Yeah, your body's a little bit with the rest of you.
And I've always kind of felt, and I don't know if it's the way I stand, but I feel like, and probably my desk and using my mouse, but I feel like my right shoulder is a little forward.
Look at you, yeah.
But
A little bit, yeah, a little bit more anteriorly rotated. Very slight. Probably can see from up here just a tiny bit, but when we're on the mouse, we want to have it, keep the, got to get the, it's got to be at 90. Anytime your arm goes forward.
yeah. I invested in a standing desk now, so I have one at home, so I can kind of stay, because I know that just over time and natural and everything, I'm just especially the longer days, you just start sinking in that chair a little.
Do you feel any symptoms in your feet ever? I'm just curious.
I do get a little kind of in the arch and stuff. Nothing more so kind of down here.
On the front part of the.
Yeah, and on this side, especially up in here.
Okay, we'll check that. That should get better. That's tied with the head. So the more forward your head goes, obviously the more weight goes to your toes. We're supposed to have about 70-80% of our weight on our heel at any one time. And so if there's too much weight on the toes, the muscle you're pointing to is contracted. And that's what's going to eventually fatigue that muscle, cause soreness. And then that muscle, called the tibialis anterior, is what the tendon of this muscle up here is what supports the arch in the foot. So if this gets tighter, it pulls the arch out of the foot. So the arch being reduced in the foot is what causes that pain or tenderness on the bottom of the foot. So keeping the head back will alleviate that tension and then also help restore the arch. I saw a video once of a foot with a shoe on. They took a motion X-ray and they showed a foot obviously with no shoe on, and it looks like a bird's wing. When you go from heel strike to toe off, it looks like a bird's wing flapping in terms of the bone structure and the way they look under X-ray. And then they showed another video with a shoe on, typical toe box, squeezing. It looked like a lobster, like a paddle now. It didn't have the fluid motion that the foot should have, and now you create pressure points. And so, like you're saying, the shoes that you're just saying, that might help to alleviate some of that.
Well, the wider toe box, allowing your feet to display,
I think like that lobster, the red lobster, with the rubber band around his claw. That's what our foot looks like with a shoe on, a typical shoe, where it's binding up the toes. Go ahead, bend the knees for me. Take a deep breath in for me. A little deeper here. Exhale, let all the air out. There we go, let it all go. Good, a deep breath in. And back. Keep the knees together, knees together, knees together. There we go. Good, deep breath in. And exhale. Let it all go. Let it go. Nice. Nice and supple. There we go. Put the hands right here. Take a deep breath in. Exhale. Look over this shoulder as best you can. There we go. There we go. Nice. Other side for me. All right, deep breath in. Look over this shoulder as best you can. Keep exhaling. Arch. There we go. Twist. Breathe. Oh boy, a little tight there. Yeah, I feel it. Exhale. There we go.
go. Face up for me. Okay. Nice. There we go. Okay. Relax here. Relax here. There we go. Nice.
Definitely trying to like consciously, be aware of it more.
Excellent. Excellent.
And then moving around and walking and taking some breaks there.
Excellent. Yeah.
To,
think of it like interweaving throughout your day.
Mhm.
Some extension. It's almost like our stomach. We don't try to expect our stomach to go all day and never never put anything in it.
Yeah.
And not to hurt it by, I got about 5 p.m. and my stomach was killing me. Well, do you feed yourself? So our spine, sometimes even the 1 meal a day of stretching might not be enough. We got to try to throughout our day.
Yeah, for sure.
There we go. Ahead. Okay. Nice. They found within 10 days of a joint not moving that it forms like a crystal or a sandpaper or a grit. Think of it like a plaque on a joint that doesn't move. And it can happen to any joint, but when it happens to the glenohumeral joint, we call it frozen shoulder.
Mm-hmm.
And there's 2 options given. They can either do 3 months of physical therapy, or they can knock you out and move your shoulder around and break loose all the adhesions. But my point is that it can happen to any joint in the body. If you don't move it, if you don't use it, you lose it kind of idea.
Yeah.
And so the joints are supposed to overlap like a handshake, and when there's crystals or sandpaper on the joint, that causes the joint to get stuck, not fully overlap. Every visit we can take you deeper, try to keep working on. There we go. It just isn't required. It's not like many activities in life require the upper neck to function, and then the head goes forward. These all suboccipital muscles up here get all jammed. It binds up the motion of your atlas axis, and then the lower neck overworks, and you go into forward head posture, and it's a whole clinic on how this happens. Awesome. But yeah, no, I'm just going for the last kind of a deeper layer here. There we go. There we go. There you go. Yeah, pretty strong thumbs. I think he's starting to. Oh, what are you doing? You gonna push? When's the care gonna start here?
Yeah, we went on vacation and I had a pillow with a lot more stuffing in it than I've ever wanted, and kind of felt that left side.
Left side right here, yeah.
Yeah.
It's I feel like the right side is, if you brought your head back, it probably would bend more on the right, and the left stays restricted. We want to get the drawers moving evenly. That's what I'm feeling. You can see over there. I'm not sure from previous content, Carl, did we?
How much was there?
How much was there before?
There was,
Someone on the left
The
side?
first time it was
A lot right here.
Yeah.
a lot, yeah.
The right side of your neck felt great. I moved on, and then I was going to move on until I found this lump right here, and then we're just going to sit here and try to dig it out of here.
Yeah.
But that's what you can feel in the left side. He's got an old injury. Sometimes when the injury happens before 26, it was in the cement when the cement hardened, and it's harder to pull it. Not impossible, but just like now you have to reheat up the clay or reheat up the cement and then fill it in and blend it over. Yeah, right there.
Here, like in the, it's almost like it wants to, like it's holding it, in there from going, especially when I'm doing the dinner roll, and like trying to really go above the head.
Go ahead and sit for me facing this way. I've personally lived with that one, and I've had my wife do exactly what I'm about to do to you. Just dig in there and clean that out.
Yeah. Yeah, it feels like there's just like almost like a door stopper.
Yeah, the attachments
It's like,
in here.
no, you're not going to go any further.
Yeah, we gotta clean that. My favorite story was I was chasing I think it was my son up the stairs, and I jammed my big toe into the upright of the stair. And of course, as I was trying to, it was one of those little hashtags and an exclamation point,
Yeah.
I was trying to not curse in front of my kid anyway, and so put my child to bed,
went downstairs, got the ice out, started icing my toe, did like 10 minutes on, 20 minutes off a couple times, and I said, okay, toe, you're on your own, get better.
Yeah.
And after maybe a few weeks, there was no pain walking around, but if I touched my toe or, went in there and felt the joint, I could feel something wrong when I put it through a range of motion, not just walking. And
Yeah.
anyway, I don't think it was going to self-resolve until I went in there and dug it out. It wasn't leaving. And
Yeah.
then my wife would try to have a conversation with me while I was working on my foot. Ed, I want to tell you about today. I'm like, can't talk right now. Digging on my toe.
Yeah, my left side's always been more because that's my problem arm too, with all the golfer's elbow and tennis elbow. And the right side's not nearly as bad, but it still has like that same little bit.
Yeah, this is what you're feeling right in here. When you bring your shoulder back, all this tissue is compressing, and because there's inflammation here. Now, we'll do it again in a second, you'll see a huge difference. This is right, Carl. I mean, I've had to do I sprained my shoulder, the back of my shoulder, doing chiropractic, especially the side posture move, and I like, help, Colin, get that out of me. Good.
We're just getting very good fun.
Your wife made any comments? She's
She thinks she's put up with me trying to fix it for so long that I think she's like, okay, we're finally seeing some progress here. Like, this is great. This is great.
She got the popcorn just watching you get beat up.
Basically.
Interesting.
Yeah, because when I go home, it's like, well, we did this, and check out this new toy. And she's like, okay, we'll throw it with the other ones, I guess.
See how it feels coming back now.
Yeah, a lot better.
Yeah.
Now I can feel this one more.
No, hey, you missed the other side, Ed.
Well, it's like because normally it's this way. It's
That one's better.
A little cockeyed,
Right.
But now it's like the other way. But no, it feels.
Isn't that cool?
Yeah.
Yeah. So your ability, is
Yeah.
pulling that back looks good. Yeah.
Has she ever been adjusted?
She is not. She's been talking about it. I'm like, look, you let me know. We'll take a trip. Come down.
You know what to
Dr. Ed.
expect. I
Yeah.
got it all. Here's one. I'm not sure if I want to sign up for that.
Yeah. I was like, look, I'm a veteran. I can tell you what's going to happen. Yeah.
Feel as much on this side as, there's still a little bit in there, but right there, real quick, it comes out. Back part of it.
When you have your arm like that, it looks like you have no arm. I'm like, this might be a good thumbnail, actually. Like,
I think I might take his arm off.
What is it, like cracked and popping new arm into place?
This is where you're working, right? Good. This is the peak right here, Carl.
Yep.
This is where you want. The most bang for your buck is right in here. Now there's the yellow guy we're going to show you in a minute. It goes in between the shoulder blades, and there's benefit here too. But I probably would still recommend that he spend most of it. I mean, if you 20 minutes here, then you have more time. You do 20 minutes here. You just hover around.
Yeah.
In terms of, you can feel the difference. This is like smooth, right? Relatively.
Yeah.
And then I have whatever you want to call this. I don't know if we have medical words. Just crunchy. There's just bumps and Belgian road here. This is where I want the time. Okay. There you go. There, you almost can hear it.
Mm-hmm.
You're good, I got you, bud. Exhale.
Okay. We never really put a limit on our time bending forward.
Mhm.
You know, people don't sit for 16 hours or 14 hours and go, is it okay if I sit for another 2 hours?
Right.
We don't really ever put a limit. And so people ask me, should we put a limit on bending back? And I'm like, well, no, not really.
Mhm.
It's whatever is practical and what you can handle and
Yeah.
tolerance. But you know, we're trying to make up for years of lost time, of lost imbalanced time.
Yeah.
Okay. They act like cars that we can just go in and just put things in and take things out. It's like we're not
Mhm.
cars, we're living tissue.
Yeah.
Probably more analogous to like a beehive. You know, it's not something, it's like a living entity.
Mhm.
You go in there and start taking honey out, think the bees are gonna notice.
Yeah.
You know, it's like. One person on YouTube, not if you use a smoker red. You gotta smoke those bees. Yeah, this feels really good relatively. This is not nearly enough, right from here down. Tell people all the time, the first couple visits, you'll be the one. And by the fifth visit or so, it's like, or even earlier, you know, that I'm the one.
Mhm.
You're just telling me about your day, and I'm working my butt off.
Even the difference between like last visit
Mhm.
and this visit, like it, for me, it feels a lot better.
Cool, that cool. Okay. So yeah, the baseline is the mobility determines the cleanliness of the tissue. So as the mobility goes down, then that's what allows the lactic acid to get trapped in here and soreness to be sequestered off. And so oxygenating the area helps to release the acid and reduce the soreness, and then that allows you to stretch deeper and deeper. Think of it like going to church sometimes. You hear the same things over and over again because you have to, they're important. That's where the air. Feel that, Todd?
Mm-hmm.
Yeah.
No,
Like
just
sand. Feels like
paper.
sand. Yeah. Feels like sand.
Yeah.
There's like little. It used to be like a rock. Now it's like
Mhm.
little tiny granules of sand underneath the skin here. And I don't know, like if you had sand underneath your shirt, and then you like were feeling above the shirt,
Mhm.
on top of the shirt, and underneath you could feel all the sand underneath. Yeah, right here. underneath the bed. It's like when you move the couch and then you sweep or vacuum underneath the couch. Like, oh, popcorn. Why is there always popcorn? What's wrong with popcorn that it always goes underneath the cushion? I always find something right there. There. I think it was the left one. Yeah, the left one was definitely more restricted. This one moved. Again, more of that right abuse. I'm going to work the left. This, you might notice a difference from, this doesn't feel too bad over here. A little bit right there. This joint didn't want to, you're right, at least 10 degrees, probably 15 degrees less ability to rotate in this side. And that's a lot to do with the left, these joints on the left not compressing over here,
Yeah.
but also the joints on the SI joint not wanting to.
So it's going from here kind of down.
Right. Your left is like your blocked up side.
Mm-hmm.
The right's the abused side. It starts in that left upper neck and the left middle back. And
Does it translate that way? Like the one side will get just like really
Right.
gnarly, and
Yeah.
then it'll be like just move to the other side because you're restricted
Compensatory.
and can't move.
right, compensatory.
Yeah.
Right, yeah. This is right here. This is tighter over here. But typically the side that's tight is guarded and doesn't age as quickly. It's the side that is loose, that is mechanically overworking and overstressed. The tooth that you chew on the most is the one that thins the enamel the most. And so this is nice. Oh, I'm going to target this middle back right there. I know. Breathe. Good, breathe. Yeah, breathe. Nice, breathe. Oh,
Yeah, that was good.
did good.
Yeah.
Need a moment to
Yeah.
review.
No, I'm good. That was just a lot deeper than.
Just here, starts right here.
I think it's when something finally like lets go.
Mhm.
It's just like, oh, okay,
Yeah, no.
there we are.
Yep.
Yeah, now it's fine.
Breaking loose those crystals in there. Yeah.
Mhm. Especially when something's like that, like as tight as it has been. It's like when it finally lets go, it's like, oh, okay.
It feels good there. Just yeah. We wanna... The arch is just responding to. It's mainly postural at this point, but I wouldn't be surprised if that muscle gets fatigued. You know, it's just that more weight goes to your toes, but nothing's jammed here. Toes are all moving. Sometimes when we have too much weight on the toes, the phalange metatarsal joint in here will get jammed, and that won't. That's mainly what we're checking for, is making sure that these joints are moving. So no, it feels good. Feels good. Good. Nice. There we go. All right. Interesting, Ed.
So what is the difference between
Right.
like the therapies?
So they're both trying to stimulate blood flow. Just two different approaches. One is a more stimulating the skin.
Mm-hmm.
So your massage, like massage almost. Gua sha is almost in the massage category, transfixion category. Cupping is creating like a pressure, right? You're creating a suction type pressure, which is drawing a lot of blood to the area, right? And then as you release the suction, you're then allowing it all to rinse out. So you're maybe like a tall building, you know? It's hard to pump water to the 50th story, so that area is all dried out, right? So the cupping creates a suction event to draw the blood, in a sense, the water up to the top story, and then you can allow it to go down all the stories and flush out everything that's in the tissue. It's probably a little less intense. I think that the gua sha can be, you know, more sore as you're doing it. To me, once you handle the gua sha, this is milder. You know, this is something that you could get for yourself. Your wife could set you up. You know, like for instance, if you didn't have somebody to help you, I mean, again, but you need somebody to help you usually with your back anyway to get it set up. But the idea would be that it requires less technique. You just put the cup on where it hurts and let the, you know, the suction helps to break loose the intermuscular layers. You know, we have a superficial, a middle, and then a deep layer to the back muscles. And so when we have injuries and scar tissue and traumas, adhesions and glue form between the layers. Does that make sense? And then restrictions, joint restrictions, pain, soreness. So
It does kind of feel like you're getting like raised up a little bit.
release.
Feels good. Yeah, it's like it kind of resettles. But it's still, I can still almost feel it.
You
Yeah.
stretch, how's it looser?
Oh, it feels so much better.
Cool.
Yeah.
All right, you got to tilt your head right a little bit for me. Tilt your head right. There we go. There we go. Yep.
How's it going? Yeah.
Yes. I got you. Do it. Tilt to the right. Okay. And that's
It's not something that you would like anticipate.
All right. Tilt your head to the left. Yeah, there we go. No problem.
That was good.
And just tilt for me. Tilt left. No. Nope, nothing on top.
Yeah. Appreciate it.
I appreciate it.
Yeah.